Definition: COPD is a chronic inflammatory lung disease that obstructs airflow from the lungs. It includes conditions like emphysema, chronic bronchitis, and in some cases, asthma. Symptoms may include shortness of breath, wheezing, cough, mucus, sputum production, and chest tightness. COPD is a progressive disease, meaning symptoms gradually worsen over time. The main risk factor for COPD is long-term exposure to lung irritants, especially cigarette smoke. Other risk factors can include exposure to chemical fumes, dust, air pollution, and genetic factors, like alpha-1 antitrypsin deficiency. Pathophysiology. In COPD, less air flows in and out of the airways due to one or more of the following. 1. The airways and air sacs lose their elastic quality. 2. The walls between many of the air sacs are destroyed. 3. The walls of the airways become thick and inflamed. 4. The airways make more mucus than usual, which can clog them. Diagnosis. COPD is diagnosed with a test called spirometry, which measures how deeply a person can breathe and how fast air can move into and out of the lungs. Treatment. There is no cure for COPD, but treatment can help ease symptoms, lower the chance of complications, and generally improve quality of life. Medications, such as bronchodilators, steroids, and antibiotics, can help. Oxygen therapy and pulmonary rehabilitation can also be beneficial. Nursing interventions. 1. Breathing support. Encourage deep breathing and coughing exercises, teach pursed lip breathing, and provide supplemental oxygen as ordered. 2. Promote physical comfort. Position the patient to maximize ventilation, such as high Fowler's position, and provide rest periods to prevent exhaustion. 3. Nutrition. Patients with COPD may need a high-calorie, high-protein diet, with small frequent meals. 4. Patient education. Teach about medication use and side effects, the importance of flu and pneumonia vaccines, and smoking cessation, if applicable. NCLEX style questions. 1. A nurse is teaching a client with COPD about pursed lip breathing. The nurse should instruct the client to do which of the following? A. Inhale slowly through the nose and exhale through the mouth with lips pursed. B. Inhale quickly through the mouth and exhale through the nose. C. Inhale and exhale rapidly through pursed lips. D. Hold breath for a few seconds between inhalation and exhalation. Answer: A. Inhale slowly through the nose and exhale through the mouth with lips pursed. Rationale: pursed lip breathing is a technique that helps to slow expiration and prevent collapse of the small airways, which is common in COPD. It involves inhaling slowly through the nose and exhaling more slowly through pursed lips. 2. A patient with chronic obstructive pulmonary disease, COPD, has been prescribed corticosteroids. The nurse knows that this medication is used in COPD primarily to A. Improve airflow, B. Reduce inflammation, C. Prevent infection, D. Stimulate respiratory drive. Answer: B. Reduce inflammation. Rationale: corticosteroids are anti-inflammatory medications. While they do not directly improve airflow, they reduce inflammation in the airways that can lead to narrowing and obstruction, which indirectly improves airflow. 3. A nurse is caring for a client with COPD. Which of the following signs might indicate that the client is experiencing a complication of this disease? A. Decreased respiratory rate, increased oxygen saturation. C. Weight gain, mental confusion. Answer: D. Mental confusion. Rationale: mental confusion can be a sign of hypoxia, a complication of COPD. As COPD progresses, the ability to oxygenate the blood decreases. This can lead to decreased oxygen in the brain, causing confusion. A decrease in respiratory rate and an increase in oxygen saturation are generally positive signs in COPD. Weight gain is unrelated to COPD status. 4. A client with COPD is on long-term oxygen therapy. Which of the following instructions should the nurse provide to the client? A. Use your oxygen therapy 24 hours a day. B. Use your oxygen therapy only when you have shortness of breath. C. You can adjust your oxygen flow rate as you feel necessary. D. Avoid open flames and flammable products while using your oxygen. Answer: D. Avoid open flames and flammable products while using your oxygen. Rationale: oxygen supports combustion, making it easier for a fire to start and causing it to burn more intensely. Therefore, it's important to avoid open flames and flammable products while using oxygen. Long-term oxygen therapy should be used as prescribed by a healthcare provider, and the flow rate should not be adjusted without medical advice. 5. A nurse is caring for a client with COPD. Which of the following nutritional interventions is most appropriate? A. Low protein, high carbohydrate diet. B. High protein, high calorie diet. Low fat, high fiber diet. High carbohydrate, low calorie diet. Answer: B. High protein, high calorie diet. Rationale: patients with COPD often experience weight loss due to the increased work of breathing, so a high-calorie diet can help to maintain weight. Protein is needed for muscle strength, including the muscles used in breathing. Thus, a high-protein, high-calorie diet is often recommended. Here are a few additional points and sample NCLEX questions. Remember to always think of the ABCs, airway, breathing, and circulation, first when answering questions related to respiratory issues such as COPD on the NCLEX. Monitoring. Regular monitoring is vital for managing COPD. Monitor the patient's respiratory rate, oxygen saturation, breath sounds, and level of consciousness. Be alert for signs of respiratory distress or failure. Psychosocial considerations. Living with a chronic disease like COPD can be challenging and may lead to feelings of anxiety and depression. Providing emotional support and referring for mental health services as needed is an important part of care. Smoking cessation. If the patient smokes, providing resources and support for smoking cessation can be one of the most effective interventions. Remember, the primary goal in managing COPD is to enhance the patient's quality of life, prevent complications, and slow the progression of the disease.